by his mother because of a bloody nose that has continued to bleed for over an hour. The mother reports that her son has a history of easy bruising and is worried because one of her relatives has some type of clotting disorder. The child is holding a bloody cloth to his nose with blood visible under his nose, mouth, chin, and t-shirt. On assessment, bright red blood is dripping from his nose. Based on these findings, the healthcare provider is concerned about a clotting disorder and orders a series of coagulation studies, including partial thromboplastin time. Now, normally, bleeding is stopped by the process of hemostasis. First, platelets stick together to form a plug. Then, the coagulation cascade is activated, which involves several clotting factors that interact within the intrinsic, extrinsic, and common pathways, ultimately creating a mesh that stabilizes the clot to help stop bleeding. Now, partial thromboplastin time, or PTT for short, assesses the intrinsic pathway by measuring in seconds the time it takes to form a clot. An activated partial thromboplastin time, or APTT, is when an activator is added to the sample to speed up clotting time and produce a more narrow range. So, the normal range for PTT is 60 to 70 seconds, while the normal range for APTT is 25 to 30 seconds, depending on the activator used. The critical level for PTT is 100 seconds, and 70 seconds for APTT. Alright, PTT can be increased if there aren't enough clotting factors, which can happen due to reduced production, inactivation, or if the clotting factors get used up. First up, inherited clotting disorders can cause a deficiency of a single factor, like with hemophilia A, when factor VIII is missing, and in hemophilia B, when factor IX is missing. Likewise, in von Willebrand disease, there's no von Willebrand factor, which is a plasma protein that helps platelets stick to injured blood vessels and acts as a carrier for clotting factor VIII. Next, since clotting factors are created by the liver, severe liver disease like cirrhosis can reduce clotting factor synthesis. Another way PTT can increase is if a clotting factor is inactivated. This can happen therapeutically when clients are given heparin, a medication that inactivates factor II to prevent clotting. Finally, clotting factors can be depleted in disseminated intravascular coagulation, or DIC, which causes widespread thrombosis that uses up clotting factors. Alright, PTT is typically measured if there are signs or symptoms of impaired coagulation like easy bruising, hematoma formation, which is a collection of blood in the tissues, hematosis or bleeding in the joints, excessive epistaxis, also known as nosebleeds, or gastrointestinal bleeding, which could present as either blood in the stool or emesis. PTT is also measured to check for inherited clotting disorders and monitor liver disease. Additionally, PTT can be used to establish the client's baseline PTT before starting anticoagulation therapy and to monitor the effectiveness of heparin therapy. Alright, let's look at the nursing management for a client with an elevated PTT. Goals of nursing care are to assist in identifying and addressing the underlying cause and monitoring for complications. Begin by collecting a sample by venipuncture. Typically, you'll use a light blue top tube. After obtaining your sample, gently invert the tube 5 times to mix the additive sodium citrate without causing hemolysis or breaking apart of the red blood cells, which will alter the results. Keep in mind that clients taking an anticoagulant or with altered blood clotting often have increased bleeding after a venipuncture, so be sure to apply pressure to the site. Now, if your client has an elevated PTT, monitor for signs and symptoms of bleeding and implement bleeding precautions, such as avoiding unnecessary invasive procedures, multiple blood draws, or intramuscular injections. Also, implement fall precautions to help prevent injury. Monitor your client's serial lab results, and if their PTT exceeds 100 seconds, or APTT is above 70 seconds, notify the healthcare provider immediately as this is a critical level. Alright, as a quick recap, PTT and APTT measure the time it takes to form a clot. Causes of an increased PTT include clotting factor deficiencies, consumption of clotting factors, or inactivation of clotting factors. PTT is typically measured if there are signs or symptoms of impaired coagulation, to check for inherited clotting disorders, monitor liver disease, establish the client's baseline PTT before starting anticoagulation therapy, and to monitor the effectiveness of heparin therapy. Nursing implications include assisting in identifying and addressing the underlying cause and preventing complications.